So I didn't hear anything, but this is hard for me. Neil, you know, I'm not prepared to shut up, you know. I'm always trying to speak, but okay, I'm shutting up now. Yeah, well. Yeah. Well, okay. We had the same discussion because we have both stents in the stock. The one is the V12 with the 60 millimeter maximum balloon diameter, what you obviously can redilate up to a recent diameter of 24, 25 or so. But in this particular case, we wanted to put in a stent, obviously a covered stent, which you not have to remanipulate a lot of after inflation. And the second thinking about our approach was that what you have mentioned as well, we probably will not get up to the maximum diameter because we will have the patient back for redilation to avoid any feeling in terms of headache because she is under a hypertensive medication. And if you would drop the arterial pressure too much in the upper lobe, it is probably one of the causes for these patients. So what we did, we chose a covered CP stent, 39 millimeter in length, mounted on a 20 millimeter bib balloon with a 5 centimeter balloon length. And this is prepared, and we are ready to bring that up. If you please, Stefan, can we have the last injection in the sheath? We choose a 14 French blue long sheath. placed. This is the advancement of the sheath, as you can see here, coming from the lower limb, and this is placement of the sheath just at the aortic arch. No, the last one. And now we are prepared to bring up the stent as I told you, and then we will see where we are going to place it. Okay, flush on the blue line, please. That's right. That's right, Said. But this is what you can rule out, if I understood it right, afterwards, if you did the final angiography, whether you have to readjust the initial dilatation.
And furthermore, yeah. Right. Yeah. Yeah. That's right. Yeah. Yeah, but on the other hand, yes, right. Okay.
Well, that's a good idea, because we just have the stent nearly in place, and I will do another test injection to see where we are, as you can see here in a minute. So it is a very nice silhouetting of this proportion of the stent. The stent is pretty much in that anatomical position where we start to inflate. So I will deploy the stent partially. I probably will have as you can see in the lateral, the B-plane, here you can see there is in between the vertebrae this space. This is probably the part which I will have nearly in the middle of the stent before we get inflated. And in the A level, in the A plane, please, back to the A plane. Okay, here you can see there is a mild calcification, which is right to the catheter. And this calcification has to be at the distal part for stent placement. Okay, so I will partially deploy the stent as we just discussed. And now the pressure measurement on my side is starting to get decreased, and I will have another injection to make sure that everything is in that place where we want to be. As you can see here, I think it is a very nice position, probably a bit more up.
Why do you want to think so? Well,
so like this. Okay. I will make the final angiography here, which is not bad. And now we will inflate the inner balloon. So, Peter, inflate the inner balloon. Yes, of course, this is perfect. Okay, we will have another check here. Peter, here, just to check.
Yeah, good.
Which seems not bad. And now we are going up with the balloon. Yeah, you're going up with the balloon. I will withdraw the sheath a bit more, Peter, bit more. Okay, stop it now.
Okay, very good.
That's good. We saw a little bit of a recoil but we can check later on.